Hi, my name is Dr. Vanessa Ruiz, and today on our healing hour, we're going to be talking about coping with grief. And I'm here with Jennifer, who is a therapist at Cactus Flower Healing, and she's going to be talking about coping with grief and how she helps her patients. So, I thought that this was kind of an important topic, especially during the pandemic, and also because a lot of the times nurses don't really take the time to necessarily process grief. I remember when I was a very first year nurse, I had an experience with a patient who unfortunately passed away. And the way that I processed grief was that I didn't. I ended up just kind of stuffing it and kind of moving forward through my shift, not really thinking, not really trying to think about it. But what ended up happening over the next couple of weeks was I would wake up at night just thinking of him and seeing his face. And then also the way that I responded with patients was that I was almost overcompensating, like kind of hovering over them, almost double checking to make sure that they were okay. And for me, I learned about trauma, I learned about kind of PTSD, but it didn't process to me that my symptoms were PTSD, that I was suffering from a trauma. And so my hope today is that you can understand your own language and your own symptoms of what it's like to be able to grieve and to help you cope and give you skills to be able to grieve. So without further ado, Jennifer.
Thank you. Thanks so much, Vanessa. And as Vanessa said, I am a therapist. I am in private practice, and I just started this year, which is, great. It was great in February, and then in March and April, I was like, oh my God, what did I do? So obviously, this topic comes up a lot in my work. And the first thing I want to do is just thank you guys for everything that you do. I know that nursing is similar to therapy in that you do it because you can do it. You can compartmentalize the things that are hard. You can not take all of that on, and which is a gift, right? But then also that's what makes it hard, because I think you get really good at doing that, and then sometimes you don't know how to not do that. So I think that one of the things about the grief process is, and when I was talking to Vanessa earlier about what I wanted to talk about, is that I don't think that we acknowledge, as helping professionals, we acknowledge how hard this job is, because I think there's so much around, we have to be strong for other people, and then we don't acknowledge how hard it is. And sometimes just saying, wow, this is a really tough thing that you're doing. This is a really hard thing. And no wonder it feels this way. No wonder it feels overwhelming at times. So with that, I thought we could start with the stages of grief, the handout. If you have that one, Vanessa, if you want to share that one, and just kind of walk through it. And hopefully, and I asked Vanessa if she has participation. So it looks like Erin, it might be on you, Erin and Pat, hopefully. It might be on you guys to participate if you feel like it. So you may or may not be familiar with the stages of grief. They've been around for a long time, and Elizabeth Kubler-Ross developed them originally as stages of grief around people who were dying. And so what she saw as she continued to work with people that were dying was also that people who had suffered the loss went through the similar stages. And so I thought maybe we could just walk through these a little bit. And if you feel comfortable in sharing, maybe some of your own experiences around how this shows up for you. And maybe you're aware that, oh, wow, this is what's going on. And maybe you're not. So I think it's always helpful to walk through it and then realize that it's not linear, right? So if you don't go denial, check, anger, check. And then now I'm in acceptance, and oh, everything's great. Because then something happens, then you have an anniversary date, then you have a global pandemic, right? That's like, okay, it brings all of that back up. And we were talking just a little while ago about how this pandemic is a grief process. And a lot of the things that are coming up for people are grief at we can't do the things we used to do. Obviously, grief at people dying, people being sick, but also it brings up grief that you may have had from earlier in your life, grief about lost relationships, grief about people dying. So just recognizing that's something that not only are you experiencing when you have a personal loss, but as a country, as the world, we're also experiencing that on a daily basis. So the first stage is denial. So this can't be happening. So that shows up a lot as refusing to accept reality, acting like things are normal, everything's going to be fine. It's not that bad. Dissociating. So just kind of mentally zoning out. All of those things are associated with denial. So does anyone have any kind of resonate with that denial?
I think what you mentioned about compartmentalization, I would see that as a form of denial, because like, oh, whatever, like almost being dismissive. I've seen that happen for me, where I'm like, all right, I'm just going to focus, and it's kind of like, let's just keep going. Like, let's not really linger at that thought. And
right.
So I don't, the words, this can't be happening, isn't occurring in my head. It's more of like, let's just keep going.
Yeah. And I think that's true. I think that there's just the two sides to that, right? Like the ability to compartmentalize just to get through the day and just to get through the things that you need to do is one thing. But then I think when it stays there and then we don't ever acknowledge that these are the things that I'm keeping, during work is one thing, I think. But then when you come home or, with your family or with your friends or with your coworkers, I think that's another thing. And then how good a job are you doing, at keeping it down? Like, is it in that cabinet that you keep locked away and then it never comes out? But yeah, that's a good point.
And I kind of also want to mention too that a lot of the times, when I'm maybe speaking for myself and I might be speaking for other nurses, but there isn't really that unpacking process that happens either. And so we compartmentalize, and then we end up just kind of pushing it down until we don't even know the root cause or the root event, because we pushed it down for so long. So
yeah. Therapy is really great for that, just to give a plug, and I always tell people, that everybody should be in therapy. Like, I'm in therapy and tell my clients, I was talking to my therapist. So yeah, therapy is a good time to unpack that, right? Because I have seen that there is some not unwillingness, but maybe a little bit of shaming, around admitting that you are struggling. Like, we have to be invulnerable and just, which is so sad to me, because then how do we support each other? We support everyone else, but we can't support each other. So anger, obviously, that's a pretty easy one. Anger shows up, and kind of unjust. Why is this happening to me? But also just increased irritability with your family members, especially over small things, right? Like, you burn the toast and it's like you just explode because it's just building up, right? It is building up. Relationship struggles, anger at the world. I mean, no matter what your politics are, the divided state of our world. So anger at people on the opposite side, people, anger at a lot of things that are nothing that we can control generally. And then the next one is bargaining. So I'll do anything to change this. So if I do this, things will change. If I work harder, things will be different. What can I do to make a difference? What can I do so this isn't happening? Which obviously is not possible.
Yeah.
Anyone have any experience with that?
So the bargaining is really familiar to me because I remember when I talked earlier about kind of overcompensating. And so when my patient passed away, I was almost working overtime, primarily because I was worried that if I left and that something would happen to them. It was like a subconscious fear. Like I almost didn't want to leave, right?
Mm-hmm.
I almost wanted to, if I could keep my eye on them, then nothing bad would happen to them. Like it was kind of like that, where I was kind of almost scared to give report to my other nurses,
Mm-hmm.
right? Because I'm like, did I miss something? And if I miss something, then are they going to pass away? Like it was just this replay of thoughts.
Mm-hmm. Yeah, that's a great example. And then, Erin, did you?
Yeah, I was going to say on like the bargaining part too, sometimes I feel like as nurses, we feel like the control is always on us. And so we feel like we are ultimately in control. And so we feel like then we can change that. And so I can kind of really resonate with the bargaining aspect, because I feel like I can fix anything. Like, give me something, I will fix it. And looking at it like a problem to solve. So I can see I have gotten stuck in this area here.
Yeah, that's a good one, right? And then because that feels like the only thing that you can control at that point. Like if I can just find a solution, then I can fix it. And then the next one, depression, which is probably familiar. So that feeling of hopelessness, and like Erin, you were saying, when you figure out you can't fix it, that feeling of hopelessness, like, well, then maybe I can't fix anything. Or Vanessa, like you were saying about the people, not being worried that if you left, something was going to happen to somebody else, and feeling that hopelessness of, because you can't be there all the time, and then if something does naturally happen, then that just confirms it, right? Like that hopeless feeling, sadness, tears, and I specialize in working with women, and I see all the time, women start to cry, and then they like suck it back in, and they're like, or they apologize. Oh my gosh, I'm so sorry. So I made a sign that, I love it, and I haven't hung it up yet. That says, please don't apologize for feeling your feelings.
I love it.
I'm going to hang it up in my new office. I forgot it was right there. But yeah, so just crying, and I'd say all the time, that is like, it's like that's the cleaning out of all of that feeling, all of that sadness, all of that anger, all of that everything. The crying, it helps you to be able to let it out. Obviously, probably harder to do not at work, but when we're talking about the compartmentalizing, there has to be a time when you let yourself do that, when you let yourself do the grieving part.
And I want to say something about that grieving part. I think that the crying is what we normally like process that as, oh yes, I'm grieving.
Mm-hmm.
And all the other stages we have a harder time kind of seeing as being like, oh, I'm grieving, right?
Mm-hmm.
And then the other thing that I've noticed too is a lot of a lot of people try to hold it in for so long that they will randomly cry. Like you'll be watching a commercial, or a patient brings up something and you get teary-eyed. It's because you've been holding it for so long that it's almost like going to come out any time. Whereas if you take time to unpack it and you actually allocate time to be able to grieve, then you're not having these outbursts like randomly. So.
Mm-hmm. Yes. Yeah. Yeah. Thank you. Yeah. Or you just stuff, like you said, you stuff it down for so long, for so many years, that it comes out in other ways, and it gets tougher and tougher to hold down. So you start to do, more um, maladaptive coping, substance use, or, just dissociating, just to keep it down. Um, and then the last stage is acceptance. So, and like I said before, just just because you come to acceptance and you kind of feel like, okay, things are going to be okay, and you can accept the loss, it doesn't mean that you're not going to feel these things again. You're not going to feel the anger or the bargaining, um, or the depression again. It's not linear. It's just very much stages, but kind of more like just a process that we go in and out of. The acceptance piece feels more like you're accepting that reality is what it is. And you don't have to agree with it, and you don't have to like it. And you don't have to be happy about it, but you just accept that this is how it is. Um, Vanessa, did you feel like you got to that place with your patient that passed away?
Yeah, so I ultimately came to a point where I realized I had done everything I possibly could, and that it was actually his time. I mean, he had a chronic illness, and as much as I wanted to will, it was almost like if I checked all the boxes, then he wouldn't die, right? When really the truth was that I wasn't I wasn't coming to terms with the grief, and also I was trying to see if I could control everything.
Mm-hmm.
When also this man he had a beautiful life. He was loved by his family, and really like it. He had a chronic illness, and so there was nothing I could do um, to stop that.
Mm-hmm.
And I think a lot of nurses want to have that kind of control, but really it's just a natural process.
Mm-hmm.
So,
Right. And almost you accept that as a part of the job, but then when it happens, then you have to work through the natural process of coming to that acceptance on an individual level. There is a sixth stage of grief. So I have a couple of resources, and I didn't send them to Vanessa because I figured people would probably be able to remember if they were interested. So David Kessler worked with Elizabeth Kubler-Ross, and then he is kind of the grief guru now. And if you listen to podcasts at all, Brene Brown has a podcast called Unlocking Us. Yeah, if you're a social worker, I feel like you have, like, there's like some, like thing that you're required to love Brene Brown. But I do love Brene Brown anyway. But her podcast Unlocking Us, she has different topics, and she talks about her own shame research, and she has guests. But she talked to David Kessler, and it was about grief, and it was a really, really, really powerful episode. And David Kessler has his own website called grief.com, which is pretty easy to remember. And I think he has a pop-up Facebook group now. So since COVID, they are doing weekly groups, and I think they're weekly, and they're open to anybody. But so David Kessler, what he found was that after acceptance, there is this final stage of making meaning. So making some meaning out of what happened to you. So not necessarily, it's not justifying or excusing, or, well, this person passed away because of this reason. So it's not trying to find a justification for it, but it's making meaning of the person's life, or making meaning of the experience, or making meaning of how you're going to continue living your life to honor this experience or this person or, whatever the grief is around. And so I think that that's a really beautiful thing, to think that there is something, beyond just accepting, but it's also like, how do you integrate it into your life? So that is that. Does anyone have any questions around that? Any of that?
I think that portion, I've never actually heard of that 6th stage. I've only heard really of the 5 stages. But that meaning piece is really important, because you do have to integrate it. It's not, you kind of have a new norm after that event.
Mm-hmm. Yeah. And exactly, like, with the pandemic, right? Like the new normal. And I know everyone's going to hate saying that and hearing that, but after a while, but it really is like, our lives will never be the same. No matter if we can go places and not have to wear masks, it will never be the same. So how do we make meaning out of that? How do we come to terms with that experience and make meaning out of everything that we've lost, but then find, what is the beauty in how we can continue to live? Because that's really the point, right? Is like, how do you continue to live with the grief? How do you continue to live to honor the experience? So the next part is, how do you continue to live? So the 2 things that I generally do. So the first one, Vanessa, I was going to talk about the mindfulness what skills. So the first thing that I generally do with all of my clients is talk about mindfulness. And I have this beautiful quote. So I do, in my practice, I am a trauma therapist, and like I said, I specialize in women with anxiety and perfectionism. And so always that goes back to some type of trauma, right? And like high expectations, what you generally think of as trauma, physical abuse, neglect. But what I find is, so I do EMDR, so we do some trauma reprocessing, but before you can do that, you need to have some skills, and you need to have some level of awareness of what is going on with you, because, when you are traumatized through whatever your trauma happens to be, you get cut off from yourself. You get cut off from your own experience. So mindfulness is simply being present in the moment. So being present in the present without judgment and without attachment or pushing away. So I have the dialectical behavior therapy are the skills that I actually teach people to use. So I use DBT to teach people mindfulness, to teach people distress tolerance, which we'll talk about next. So
I just want to edify DBT, because I've referred, it was created for borderline personality. However, I don't know anyone who wouldn't, just like therapy, I just don't know anyone who wouldn't learn a lot from DBT about themselves and about interpersonal conflict. And I've been referring almost all my patients to do some form of DBT, just because of all the skills that you learn. So it's just such a great tool.
Thank you. Yes, it is. And it was created to treat a high-risk population, so like high suicidality and self-harm. And then they found it was really helpful for borderline personality disorder. But it has been used to treat, anxiety, depression, a lot of things. And like Vanessa said, it is skills-based, so it gives you something. So instead of just, hey, let's talk about our feelings, I can give you skills, and we're going to practice some of those skills tonight too, so you can kind of see what it's like. But so Marsha Linehan created DBT, and I love Marsha Linehan too, and she has this beautiful quote that I think really talks about why mindfulness is important. So she says, mindfulness as a practice is the practice of directing our attention to only one thing. And that one thing is the moment we are alive. the very moment we are in. The beauty of mindfulness is that if we look at the moment, just this moment, we will discover that we are looking at the universe. And if we can become one with the moment, just this moment, the moment cracks open and we are shocked that joy is in the moment. Strength to bear the suffering of our lives is also in the moment, and it's just about practice. So I think that's a pretty good recommendation for mindfulness, but it's really true. You know, if you don't know what's happening with you and to you and what you're putting out, then you can't change anything. You can't do anything different because you're not connected to your own experience, to reality. So the practice of mindfulness includes what skills? So it's what is mindfulness? So observing, describing, and participating. And then how skills? So how you do it. So non-judgmentally, like I said, one mindfully and effectively. And I didn't include those just for time's sake, but it's really, if you can even start to cultivate an observation and observing and describing your experience and being able to, without judgment, just connect to what's happening in your environment, what's happening in your body, what's happening in your mind, then you can really start to make a difference in your life, because you can work on, okay, I am feeling angry right now, and then exploring, well, where is that coming from? And work on, I'm not anger, I'm feeling anger. This might be why, someone forgot to take out the trash. Well, they're not making me angry. I'm reacting this way because they forgot to do something I asked them to do. So now you get to have a choice, right? How do you want to react? So it is, I think, the foundational skill for change, working on changing, working on becoming a better version of yourself. So does anyone have any experience with mindfulness already?
I mean, I have probably utilized it more in the last couple years than I had in like my entire life before that. So for me, it was a mechanism that has been able to kind of like bring me into the moment.
Mm-hmm.
And I've been able to utilize it almost regularly now that it's kind of become a habit or a practice that I normally do.
Mm-hmm. What do you do, Erin? What is your general practice of mindfulness?
For me, it's kind of bringing sensation into my body at first. So kind of recognizing how I'm feeling or breathing. And then the next thing is kind of looking at my thoughts, and kind of recognizing if I'm kind of like falling into fear or anxiety. But for me, the two are very much tied together. So if I notice that my thoughts are kind of going rapid, then I tend to maybe be feeling the anxiety. So being able to just kind of draw attention to that first, then I can at least start somewhere. And like, if I'm noticing like my pulse is getting higher, my chest is getting tight, just kind of pausing in that and then taking deep breaths and moving through that.
Mm-hmm. Yeah, that's awesome. And I'm sure that you found that really makes a difference in being able to tolerate the anxiety feeling, but also being able to, like you said, work through it, because you're acknowledging it, you're acknowledging it's there, you're not trying to push it away. And then when you acknowledge it, then you're not struggling with it. You can just let it be, and then it will go away. Yeah, thank you. Thanks for sharing that. So I have a couple of exercises that we can try, and they're pretty simple. So the first one is like Erin was talking about, just around your breathing. So just noticing the pauses as you breathe in and out. So I'll read the directions and then we can do it for maybe a minute together. So as you breathe in, notice the brief pause when your lungs have filled with air. And then as you breathe out, notice the brief pause when you've expelled all the air. And so this doesn't require that you breathe deeply, just breathe normally in and out, and just focus your attention on your breathing and then the pause at the top and the bottom. And so if you want to just do for a minute, maybe just observe that and focus on your breath and the pause. Any feedback on that? Any experience? So I think you definitely see, I mean, even just with that 1 minute, right? I know I feel obviously when you're breathing deeper a little bit because you're mindful of it, then it helps you feel a little calmer. But I definitely thought, okay, I could hear my dogs barking and I was a little bit annoyed. And then I could breathe in and notice the pause and breathe out and notice the pause and just be, okay, right back here in this experience and not worrying about the dogs and not worrying about, everything else. So I have another brief practice. And this is really good for, like Erin was saying, when you're having anxiety and you're having a lot of thoughts that are kind of starting to come to you, or you're just having some intrusive thoughts that you don't necessarily want to keep having, or just as a practice for when you want to just kind of acknowledge things and let them go. And I think this is a good way to train yourself on how to do meditation practice, because I think so many people think that, oh, meditation means I should be sitting quietly, with no thoughts, and that is impossible because you cannot stop your mind. So it's really just about having the thoughts, but not becoming attached to them, just having them and coming back to whatever, the present is. And so I think this practice of either the conveyor belt or leaves on a stream, I really like, allows you to kind of see the thoughts, put them out in your visualization, put them outside of you, and then watch them as they go away. So if you want to just get comfortable however you want, it's a short practice, so you don't have to get into a meditative position or anything. Just get comfortable and close your eyes if you feel like it, or just look down at the ground, and then just imagine that you are sitting on the bank of a stream, and it's a beautiful day, and it can be fall or spring, whatever you like the best. And the stream is running in front of you, and there's leaves that are falling from the trees. And as you notice your thoughts come up, any thoughts that come up, as you notice your thoughts come up, put that thought on a leaf and then watch it as it goes down the stream. And then the next thought that comes up, put that thought on a leaf and watch it as it goes down the stream and disappears. I'll give you a couple of minutes just to experience that. And then when you feel ready, just come back and open your eyes or bring your attention back. So how was that?
calming. I I was able to get more of the thoughts. It's like, oh, you have to do this. And then part of me was like, yeah, I don't want to forget that. I'm just like,
Like, come back.
yeah, it would come back. And then another thing I noticed too is at a certain point, my thoughts just were kind of, the volume was very turned down low, but it was really more uncomfortable, like the physical sensations.
Mm-hmm.
I'd been sitting on a desk for about 8 hours, so I was like, my back is really tight.
Mm-hmm.
And then I put that on a leaf, and I was like, all right, my back's tight. So.
Well, good, and good incorporating the sensation with the thought as well. Yeah, I think you do find that, and I always find when I do this, because I guess I know it's coming, then at first I'm like, oh, I'm not having any thoughts. Wait, that's a thought. And then I start having like this internal, like, okay, thinking is a thought. And then I'm like having this dialogue with myself, and I'm just like, okay, just continue to let those things go. And, that pressure to have a thought, let that go. But then I think too, you can almost see there is some quiet and there is some pause in there. And I think that is the feeling of, when you're doing meditation and there is this split second, where there's this quiet and there's this real connection to something outside of yourself. That I think this is my personal feeling. I don't have any research to back it up, but I think that is a good introduction to how you just let your thoughts go when you're meditating, and not judge yourself for having thoughts or expect yourself not to have thoughts. So I have, so around that, awareness of connection to the universe is a part of participating. And so that's really, like Vanessa, you were saying, like with the physical sensations. So that's really just, connecting to what am I feeling, and this exercise part of participation, what am I feeling in my body, and how do I, how am I connected to the ground that I stand on? And that's really, grounding, connecting yourself to the earth, feeling the ground underneath your feet, feeling the chair supporting your body, and kind of giving some gratitude or some appreciation to all of these objects that help us to live our lives. And they do so, right, with like just kindness and love. And so really the participate activity was just about focusing your attention on your feet touching the ground. Focus your attention on, for a moment, on your sitting in the chair and how the chair supports you, or how your, wherever you're sitting supports you, how it allows you to do the things that you do. And then I think the gratitude part is just as a nice piece. And I didn't even have gratitude as part of my recommendation, but that's always obviously a good way to shift your mindset. And then briefly, does anyone have any questions around mindfulness? No. So then the last thing that I was going to talk about was distress tolerance. So like the distress tolerance skills. And I did not have any specific ones to practice. I would say though, if you have, so I sent Vanessa the handouts, and you can share those because they are for use with, in a therapy practice, but for clients and for people that you're working with. So you can, if you want to share those with people, you can. The thing I was going to talk about just kind of quickly is, because there are a lot of skills in distress tolerance, But if you're looking through the whole packet and you're like, oh, this is overwhelming, I would suggest that the things that are the most helpful are the tip skill. So specifically the to have the, does it go down? Oh, yay. Yeah. Okay. Yeah, you can keep going. So keep going to the tip skill. Yeah, so this one. Specifically changing your body chemistry. So this is a really quick way of re-regulating yourself. And I especially like the first one, so tipping the temperature of your face with cold water. So especially, you know, if you are at work and you're emotional or, you know, things are coming up for you, you have to keep working, you have to compartmentalize, right? So what are some ways that you could kind of get back to your, you can get back to some emotional regulation kind of like quickly. I think the tip skills are helpful. So the skill itself is putting water and ice in a bowl and then putting your face in the bowl for like 30 seconds and holding your breath, which stimulates your dive response, which then makes your heart rate go woo. So, you know, if you have heart issues, obviously be mindful of it. And I know not everyone has water and ice that they can put their face in, but even if you just put, you know, cold water on your face, get an ice pack and put it on your neck, hold some ice in your hand. It helps you just kind of snap back from, okay, I'm really in an agitated state. So how do I kind of just get back into the moment pretty quickly? If you have time and space and energy to do the actual skill and put your face in the water, I will say it is really pretty amazing. And I did it and I made my group do it. So we all did it together. And at first it was like, oh, I can see, yeah, this is distracting because your face is really cold and wet. But then after probably 15 seconds, all of a sudden it was like this feeling of, it really was just like from my head to my feet, just like calm kind of just came over me. And yeah, it worked really well. So intense exercise, if you can, you know, even like jumping jacks or just like the butt kickers you do like in warming up for running, that can help you to kind of just get regulated, especially if you're, you know, feeling a high level of emotional intensity. And paced breathing. So this is not, so the paced breathing that they talk about is a longer exhalation, because then that helps your heart rate slow down. The breathing that I really like to do with people is it's a 4. So breathing in for the count of 4, holding it for the count of 7, and then breathing out for the count of 8. And it helps. So it's like somatic experiencing exercise, but it helps your physiology reset. So and stimulates your vagus nerve. So the 4, 7, 8, if you can just remember that, but the longer exhale will really help keep you calm. And the paired muscle relaxation is just, you know, from your kind of a body scan. So from your head to your feet, just each area tensing, and you can do your whole body, you can do each area as its own segment, just tensing. And then when you release, having a word like relax, calm, whatever word feels good to you. And the more you do it, the more your brain starts to associate that feeling with the word. And so if you think calm, then your body is more likely to just relax and without having to do the tension exercise. And then there's three other, there's self-soothing, which I really love, distracting and improving the moment. And they're all in this handouts.
Are they further down?
Yes. Yeah. And we don't have to talk, but you can see that they are specific activities that you can do. So and distress tolerance, I guess I could have explained before, was so if you have something that is particularly painful, or, I always say in DBT, we always talk, so it's a dialectic, so it's two things that can be true at the same time. But there's always either a problem that you can solve. So as a problem that you can solve, and then you can regulate your distress by solving the problem, and we can work on figuring out how you do that. Or there's a distress that you need to tolerate. So if there's no problem that you can solve, so COVID is a perfect example, right? Or grief is a perfect example. There's no problem to solve. You can't think your way out of it. So it's a distress that you need to tolerate. So these skills help you tolerate those emotions, those things that you can't fix. Like Vanessa was talking about earlier, you can't fix them. You just have to tolerate them until they get better. And so these are specific exercises that you can do. Self-soothing uses your senses, and I always start with that one with my clients and have them do those daily. And what I would encourage you to do is just commit to 5 minutes. So 5 minutes of distress tolerance a day is not a lot. I feel like everyone can commit to at least 5 minutes, which is sad, right? Like we're having to commit to 5 minutes to ourselves. But if you can start with 5 minutes, then you can do more. But even 5 minutes is going to help you feel better in the long term. And I know that was quick, but these are more things that you can do, on your own, that you hopefully can incorporate into your daily life, and then use them, right? You have to practice them in order to have them when you need them. So use them daily so that you can use them when you need them. Use them when you're calm so you can use them when you're not calm. Any questions around that? No?
I do tell my patients, can you hear me?
Mm-hmm.
Okay. I do teach them breathing exercises, and especially with my panic attack patients, I'm like, you have to practice them. It's like the gym. It is not a good idea to start the breathing practice having a panic attack.
Right. And probably not the first thing that you think of, right? When you're like, wait, let me think about this really calming breathing activity. Yeah, no. So I thought maybe we could end today with a little visualization, a guided visualization, and it's from DBT 2, big surprise. And it is kind of designed to help you get to your center. So get to that core, get to the place of your own intuition. So that calm place where that's always available to you, but that we don't always have a connection with. And that place is going to really help you when you are dealing with grief, when you're dealing with whatever comes up for you, because that's like your gut, that's that place that balances the emotion and the logic and really is your center. So if you would this time, if you want to get in kind of a whatever comfortable position, I usually say uncross your legs and arms, and then put your hands on your lap, either face up or face down, whatever feels comfortable. And if you want to close your eyes, you can, or just look down at the floor. And then just start before I start the visualization. Just start kind of grounding and centering yourself right now. Just notice your breath. And then notice where you feel your breath in your body. So do you feel it coming in and out of your nose? Do you feel it in your mouth? Do you feel it in the back of your throat? Do you feel it as the rise and fall of your chest or of your stomach? Just spend a few seconds kind of noticing where you feel your breath. And then I want you to imagine that there's an inner spiral staircase within you. And it can be anywhere you want it to be. You can look any way you want it to look. But I just want you to imagine that you're walking down the staircase. And you're going at your own pace. And the staircase can be as light or as dark as you want, with as many windows as you want. Just walking slowly down. And as you walk, just notice how you feel. Just notice your thoughts. And sit down on the steps if you wish. You can continue walking. Noticing as you walk, moving towards your very center. Towards your own wise mind. And toward wisdom. Just walking at your own pace. And then you can stop and sit when you arrive at a still point. And then when you're ready, come back to the room, wiggle your fingers, wiggle your toes, open your eyes, but try and maintain your awareness of that clear center that's within you. How is that?
It was very, very relaxing.
Good.
Very peaceful.
Good. Well, so I think that's really helpful to know, that really you are going down into your own center, into your own core, into that place that knows that there is calm and that knows, that there's that balance within you. So that's available to you. Just sometimes it's outside of our awareness.
Well, thank you so much. This was so helpful.
Yeah, no problem. Thank you guys. Thank you for participating too, because it would have been a long hour if it was just me talking.
Can you just tell us about DBT, what the structure is like, and how to be able to get in contact with you?
So for DBT, like specifically for DBT, if you are at a higher, so if you needed that level of DBT, where you had some suicidality or self-harming behavior, that's more of a full protocol. So you would do group and individuals, but with my clients that I see, in my private practice, I use DBT with everybody. And like I said, I do EMDR as well. And so, it's just my practice is cactus flower healing. And I have a website, and it's very easy because it's cactusflowerhealing.com. And I would be happy to talk or answer any questions, anyone has, or do whatever I can to help. I'm just so happy that you asked.
Yeah, thank you so much for your insight, for your experience. It's going to be helpful to a lot of the other nurses.
Good, thank you.
Thank you. Any questions?
No, this has been really wonderful, and I think it's something that I can take with me to work and help share some of these practices with other healthcare workers and helping work through stress or grief. So I really, really appreciate you taking the time and talking with us.
Yeah, no problem. Thank you, guys.
Mm-hmm.
Thank you. And we're going to have sessions similar to this every week. And it's really on pertinent topics that are in health, in the nursing industry. So next week we're going to be talking about trauma. So.
Oh, awesome.
Thank you.
All right. Thank you. Bye.
Thanks, guys.